In this week's update from IHME on the COVID-19 pandemic, first, I think the main findings that we see in the data and in our forecasts are that the BA2 secondary surge of Omicron that has affected a number of countries in Europe appears to have peaked and is on the decline in almost all locations in Europe. Not all. There's some question about whether the United Kingdom has peaked and that the decline in cases may be due to access to testing. The tests now have to be paid for. But generally, we are seeing the peak and probably the decline of BA2 in Europe. In the United States, we have yet to see a BA2 surge. There are some states where we're seeing hospitalization number admissions go up slightly, but not seeing the reported cases go up. So it may be that there's a small increase coming in some states. Our models for both Europe and the US do not suggest, at least for the US, we don't expect a major BA2 surge, and in Europe, we expect the surges to peak and decline. The biggest factor in the analysis is the change in our results for China. We have been predicting for quite some time that Omicron would break out into the community and that China would choose to stop using a zero COVID strategy, or what they call dynamic lockdown. But given the rather stringent measures put in place in Shanghai, we don't expect, at least till the fall, that the Chinese government is going to step back from a zero COVID strategy. So what we've done is we've used in the forecasts the observed reduction in mobility based on Baidu data for Shanghai, and then assume that whenever there is an outbreak in each province in China, that there will be stringent measures put in place. And so we've put substantial brakes on transmission that way through reductions in mobility in our modeling framework. This means that we don't predict the massive surge. We expect that will come later in the year. But we do see quite a number of deaths given the quite low vaccination rates in the 80+ population in China that have become apparent. Now, it does the expected trajectory in China does point to a very important role in the current Omicron wave, but more importantly, in future new variants as they emerge, in access to antivirals. We see a lot of global discourse about access to vaccination, and that's certainly an important issue in terms of equity. Everybody who wants a vaccine should certainly be able to obtain a vaccine. But in terms of preventing death from future new variants, we think that the scale up of antivirals, particularly the highly effective Paxlovid, but if other antivirals come along that are as effective, those as well, is going to be the critical issue between a new variant, let's say, that's more severe than Omicron, causing considerable mortality versus causing 80 to 90% less mortality. And I think we will be producing in the near future, antiviral scale-up scenarios to go alongside the vaccination, booster, and mask use scenarios that we routinely produce as part of our periodic assessment of the pandemic. So those are the main findings. I think in other parts of the world, we're not seeing any evidence of a BA2 secondary surge, even in places like South Africa, where most of the transmission is currently BA2. And this difference across countries may well have to do with population level immunity, how much prior infection, how much the first Omicron wave infected people. And in places where there was a lot of transmission, there's probably enough immunity that we won't see much of a BA2 related hump. So those are the main observations as we look around the world in our assessment of the pandemic.